So for most people, when we talk about reflux, they're talking about heartburn initially, right? So heartburn can occur anytime there's any sort of difficulty with getting the stomach to empty out, which can happen with alcohol, chocolates, can happen with spicy meals, can happen with tomato-based meals. Any of that, most people would say, well, I'll take a couple of antacids and that'll make it better. And for most people, that really is all you need. It buffers the acid in the esophagus clears itself, and then you don't have any other issues. Then as those episodes become more frequent, and we talked about how twice a week is kind of when it becomes clinically significant, then we start looking at medications. So there's really two levels of medications. There's something called H2 antagonists, which will block about 60% of the acid production. And for the most part, you take it 30 minutes before a meal. That sort of blocks any excess acid production during the meal, and then you control your heartburn that way. If that doesn't control the burning, or if the burning persists despite the medications, then the next step is called proton pump inhibitors, which most people are familiar with. It's the medicine you see all the commercials for, right? And you take that and you have to take it on a daily basis to maintain a level of the medicine in your system. And that blocks 90% of the acid production. And again, it's a very effective medication. It's really designed for when the acid causes a little bit of injury to the lining of the esophagus, we call esophagitis. I tell patients it's sort of like a rug burn on the esophagus. Anything that touches it makes it sore until it heals up. And you take these medicines for about 6 weeks, and most people, 90% of people, will heal that. Now, then there are people that have heartburn if they come off those medicines, or heartburn despite the medicines, or the next step, which is regurgitation, where fluid, they can actually taste the fluid come up into their mouth. They lay down and they can taste bitter in their mouth. And those patients need a more thorough workup. They need an endoscopy, maybe a pH test, maybe testing the esophagus and the stomach to make sure they're working well. And you really sort of classify, okay, well, now is surgical therapy or some sort of procedural therapy indicated? Probably the least invasive alternative is the TIF procedure, transoral incisionless fundoplication, meaning we go through the mouth, we fold the stomach back onto the esophagus so the angle of hiss is recreated. That recreates sort of the valve aspect, and that's very effective for treating reflux disease. For patients that have a lot of regurgitation, the suspicion then is that you have a hiatal hernia. So that's when the opening of the diaphragm, the esophageal hiatus, gets big enough that some of the stomach can start slipping through. There's a procedure where we go in with incisions, we pull down the stomach, we close that back up, so you go from a big defect to a smaller defect, and now the esophagus is back into the abdominal cavity. You can then do the TIF part to recreate the valve, and that is highly effective in treating reflux disease.